All but two states are now reporting substantial increases in COVID cases.
Not Wisconsin, unfortunately. It's Oklahoma and Colorado. But cases nationwide are up 50% in the last 2 weeks.
Hospitalizations are also up, but the good news is COVID-related deaths are down about 12%. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is here with his weekly visit. Welcome back.
Hi, Dr. Pothof.
Good to see you guys.
Good to see you.
These numbers are a little unsettling.
They are. I think the game is a little bit different this time. So with the BA2 subvariant, we would expect some cases to go up. That's happening. What we're hoping for is that hospitalization curve stays a little bit lower compared to other surges where we didn't have that protection. A lot of people were end up in the hospital. So I think this is something that we'll continue to see. Cases up. Hopefully hospitalizations and deaths, they stay a little bit lower.
So what does that tell you if cases are increasing but deaths are dropping?
What that means is that immunity in the community is better than it's been in the past, and that could either be derived through vaccination boosters. With the recent Omicron surge back in February, January, February, that probably affords some people some natural immunity. The hospitalizations, death not increasing would suggest that is there, that there is some protection. As time goes on, we'll have to see if that holds. Does that immunity hold? With vaccination, you can artificially increase that. For those who are relying on natural immunity, unless you get infected again, you don't get that guarantee.
Is this surprising? I mean, we're not wearing masks, we're gathering in groups, we're going back to normal.
It's like a fifth COVID wave that's gripping the country, and everybody is...
It's like, okay, well...
Right.
Yeah, I think that lack of more severe disease has folks a little bit more at ease, but, if you wanted to know if masks and distancing worked, I mean, now is a good example, because now we're not doing those things, and we are seeing cases increase. I think likewise, though, with these Omicron variants, our protection against no symptoms at all is less. So folks who are even vaccinated, the likelihood of having symptoms if you come in contact with COVID is higher. So I think you're seeing some of that too, as these more contagious variants are causing symptoms.
Well, the Madison School District is still the children are still wearing masks in school. That's one of the only districts in the area that extended the mask mandate. Do you think that's a good idea?
I think if you have children in that school who are unable to be vaccinated or they're a high-risk population, that does help. It reduces transmission. I think for other folks, it's really that balance between the inconvenience of having COVID, even if it's mild because you're vaccinated or you've had COVID. And where that gets to be a problem is not so much with people sick going to the hospital, but the ability to do things, have extracurriculars or hold performances. Sometimes you find enough staff are out where you can't do those things, and that might be an indication to put in some mitigation if they're struggling with that.
But this seems like the opposite. It's summer, we're outside. The guy say it's going to get worse when we go inside, but it's getting, there are hot spots.
There are hot spots around the country, and what we don't know is, if this was December, like maybe it'd be worse than it is right now. Like maybe this is better than it would be. Typically in the summertime, folks are more outside. There's more, air circulation and things like that. But COVID's proven to be a pretty tough bug. Unlike a lot of our other seasonal respiratory viruses, this one seems to do okay in the summer.
The Northeast is one of those hot spots, and they're one of the most tested, vaccinated, and boosted areas of the country, very similar to Dane County, and they're still having a huge spike in cases.
I think one of the things that you see here is those areas who do the best at mitigating the waves before, where the risk was much higher, they're now more susceptible to these late waves because there's less people who've been exposed to COVID recently. They're vaccinated, they're boosted, but they are susceptible to these mild symptoms. So that might be another reason. Whereas other areas of the country that took away a lot of those mitigation strategies, a larger proportion of that population has probably had COVID recently, maybe just a little bit more protected.
Fingers crossed on the hospitalizations.
Yes, let's keep it that way.
Yeah.
Jeff, thanks for being with us.
Good to see you.
See you next week.
You bet. Well,